Okay, everybody, a very good afternoon, and thank you so much for staying online. And we have a lot of people who have actually joined in on this webinar. Just goes to show how important this topic actually is. My name once again is Mike Jones, and I will be the moderator for today's webinar. The topic, which is, should you outsource your billing to prepare for ICD 10 challenge? And we're also, it's on a high note, it's good to see a lot of people coming in. We have over 1,500 people that are attending the webinar at the moment, ranging from practice managers, billers, and physicians. Now, we will be tweeting live on hashtag CureMD, so you can go ahead and forward all of your questions over there. And please feel free to drop a comment or ask a question in case if you need to. We will try to entertain as many questions as possible towards the end of this presentation. And just in case if your questions are not answered, don't worry about it. Our team will actually be getting to you in the following days, and we will have all of your questions responded to. We will also be conducting a brief poll during this presentation, and you can go ahead and participate in that poll, and in case if there are any questions in regards to that, we will go ahead and have them answered for you. Now, let's go ahead and start off. Firstly, your host for today is going to be Mr. Ken Edwards. He is a Senior Billing Manager here at CureMD, a certified coder and educator with an extensive experience in both professional and facility aspects of ICD-9, ICD-10, CPTs, HCPCS, coding, auditing, billing, and revenue cycle management experience. So let's not go ahead and delay this anymore. I'm going to hand over the platform to Ken, and he will go ahead and begin. Ken, here you go.
Thank you, Mike. Thank you, everybody, for joining us today. We're going to start off with our agenda for the day, which is going to revolve around the impact, of course, of ICD-10 on practices and staff at practices. We're going to talk about the readiness of your vendor, if you have an EHR PM vendor assisting you during this transition, the readiness of your practice, and how to gauge that readiness at that level. We'll then compare solutions, outsourced and in-house billing solutions, and then we'll identify what you need to look for in an ideal revenue cycle management partner, especially keeping ICD-10 in mind. So with that, let's begin with a quick poll. According to MGMA, last year, 90% of polled attendees were uncomfortable or concerned about the change with ICD-10. So we want to ask you, what is your topmost concern for ICD-10? Is it physician documentation related to ICD-10? Is it the readiness of your billing department to collect on your behalf to get appropriate reimbursement? Is it the readiness of your EHR vendor in supporting you and your staff and your physicians through this change? So we're going to make that poll live now. You'll have about 30 seconds to respond, and this will give us a good idea of how you feel or what you feel is the most important focus that you need. So 50% of our respondents are already saying that physician documentation is their primary concern, and that's balancing out now with the billing department. And the EHR vendor is the smallest concern. About 10% of attendees are saying that that is their most or biggest reason of concern with ICD-10. And that's kind of appropriate. So everything will be driven by physician documentation, as our discussion will show you. Related to that, of course, based on that documentation, your billing department and their abilities in coding, in managing denials, and in working with payers, in gaining appropriate resources for the ICD-10 change, will enable you to run your practice effectively through this period. And of course, that's, I think, where we're going to end. Our poll is now closing. And so your billing department is at 49%, physician documentation at 43%. So those are the two major big ticket items. And it seems everybody's pretty confident about their EHR vendor regarding whether they'll be prepared for this change. So let's go ahead and talk about this change a little bit. And the first item, of course, ICD-10 changes everything. If you were, we anticipate that this will shake the healthcare industry. It will change how you practice. It will change how payers reimburse you. And it will pave the way for quality-based and effectiveness-based reimbursement that is coming to us in the near future. The first thing that we want to talk about, if you were part of a revenue cycle team or if you were a practice manager a couple of years ago when we were converting the electronic claim system from 4010 to 5010, you'll remember that claims were delayed for weeks. Some payers were not prepared. They did not switch on time, so we were working with both systems at the same time. And we're expecting something similar but larger to happen this time around. Even with the 1-year delay in ICD-10, we're predicting that claim errors on the practice end will increase by at least 7%. And this will be for the best prepared practices. For other practices, of course, CMS is predicting that there will be a 40% increase in accounts receivable days. So imagine a payer that pays you very, very regularly. Medicare pays you in about 2 weeks, 15 days on average. And this will now increase to 21 days just based on this delay and increase in accounts receivable processing. And this is not something the practices can control. This is related to payers. This is related to clearinghouses. And all of those parties in combined will result in this delay in you receiving your reimbursement. Associated with that is going to be a 200% rise in claim denial rates. So if your billing team is doing a average job at the moment, that will turn out to be a very bad job. As soon as ICD-10 hits, claim denials will double. You will then be spending that additional amount of time in processing payments and receiving those reimbursements from primary, secondary, tertiary payers. And if your team is able to collect fully on a claim that you billed out in 45 to 60 days, they're now looking at 3 months before that claim is completely processed. And that delay then progresses to patient balances, to billing statements and sending statements to patients, collecting from patients. And we know that that's a part of a practice that is always affected immediately. If every 10 days you delay a bill going out to a patient, you're dropping 50% or 50% chances of collecting on that bill are reduced. So one of the biggest changes that is going to be impacting you is, of course, the complexity of denials. If you're appealing a denial, you need to be very, very careful in how your denials are worded. And of course, justifying the medical treatment, you're now going to have to be that much more specific about what's happening with your denial and why you're appealing a treatment. So a lot of payers or a lot of billing teams were using generic templates for appeals. They were simply putting in, the reason for the visit or, the diagnosis, and that was a basic area where they could start from to present an appeal. Now they would have to refresh all of their payer documentation, all of the resources that they had researched in the past. So the billing team is basically building their capability of managing your denials anew from scratch. So payer policies will change, coverage rules will change, and all of this will affect on your ability to collect on your claims. And that means, on average, a 17 to 20% reduction in cash flow. Right? So as soon as we switch over to October later this year, you'll notice that your cash flow is going to be severely impacted. And this is in the case where you are a well-managed practice. And in that particular scenario, you're looking to have cash reserves and you're looking to be prepared to face that additional detail and that reduction in payments. So we're breaking down this webinar and your preparedness into two major segments. And the first of which is how ready your vendor is to support you through this big change. So in relation to that, we have a list of questions and a list of items that you should be discussing with your vendor. In terms of ICD-10 readiness, when will the product be ready and will be fully ICD-10 compliant? Will both the electronic health record and the practice management system be able to support ICD-10? When will you have access to ICD-10 so that you can start training and you can start working with your teams in that new environment? And will the new system support both ICD-10 and ICD-9 concurrently? Because, as you know, 3/4 of this year will be spent working with ICD-10, ICD-9, and the last quarter will be in ICD-10. So you're going to need support in reporting, in managing your data, maybe with PQRS and meaningful use, and anything that's associated with ICD coding through that year. In terms of cost, how much do you think your payer will charge you in order to upgrade to the new ICD-10 solution? We noticed over the last year that a lot of vendors were charging server-based installations extra because hardware needed to be updated. There was a huge cost associated with that. And so having a vendor that is cloud-based immediately allows you to stay away from that additional cost. Will your vendor provide free training and free resources, or will they charge you extra for those capabilities? In terms of implementation, will you need new hardware to update or to accommodate the new upgrade that's coming up with ICD-10? Will your EMR system or your PM system help you test your compliance within the practice at a clinical level and with your payers? Right? Is that something that you have already done? For example, there was voluntary testing with Medicare last year. It also occurred earlier this year, and the last segment of that testing is occurring in April. And CureMD accommodated, and we went through that voluntary testing in all 3 sessions. So we're going to do it in April as well. And so your vendor should already be able to tell you that they're prepared for this change. And of course, that relates to their time frame for implementation. So you need a specific date when that system will be delivered to you, when it will be usable, when you can start training and testing internally on that final implementation. And of course, lastly, what tools, training materials, and training sessions, and additional support will be provided to you and your staff for ICD-10, and that is before and after the switch. So in relation to all of those questions, what happens if you can't get satisfactory answers? What happens if your vendor can't give you an implementation or a testing date? What happens if your vendor doesn't have any resources that he can use to assist you through this change? So if all of those things are happening, then you may want to consider switching over. So based on our poll, that wasn't the biggest reason or the biggest concern for most practice managers and for most people that we're working with. So the second segment, and which is the bigger concern, is the readiness of the practice. How ready is the practice to accommodate this ICD-10 change? So first up, are you ready for this challenge? Are you aware of this challenge? Are you aware who it affects? And of course, we talked to MGMAs, and the biggest impact is going to be on physicians. So physicians know that their time is most important. They need to be spending the time with patients as opposed to documenting or working through a complex system. MGMA reports that their top issue with ICD-10 is going to be incomplete documentation. Everybody agrees that this is going to be where the problems will start. And of course, they will bundle up into the billing team and so on and so forth. And ICD-10 will have other impacts on physicians, not just in the additional time and effort that they'll spend, and which will change their daily workflow, but payers will maintain profiles on physicians based on quality, so mortality and morbidity reports. Physicians will be evaluated on how well they treat patients, so their efficiency of treating certain diagnoses and diseases. And this will link to contracting, this will link to reimbursement rates, this will link to what opportunities you get as a physician and what other services you're able to render. So related to, of course, what's happening to physicians, 20% decrease in physician productivity is predicted due to that ICD-10 change. That means you're going to be seeing 20% less patients, you're going to be doing 20% less documentation or less work, less useful work as a physician. And this will be related to new requirements in terms of what documentation needs to be collected. And that documentation, of course, will relate to more time being spent with patients collecting appropriate information, coming up with more detailed diagnoses, capturing and reporting symptoms, maybe working with expanded quality programs and revamped programs. So if you were used to PQRS and you were used to meaningful use requirements, these programs are going to undergo some changes as a result of ICD-10. So ICD-10 is expected to infiltrate your entire practice. If you're a small practice and you are the physician, you are the practice manager, you yourself are the front desk even for some very, very small practices, then the burden is on you. As an owner, you need to budget and you need to obtain, set up cash reserves to let you work through this big change. As a practice manager, then the onus of training and budgeting and reporting and implementing a plan and ensuring that everybody is kept happy throughout that entire process is also on you. As a physician, of course, we talked about the need for additional documentation. Medical schools are now considering offering a course in ICD-10 for physicians. Just because this is going to be such a big change and it's going to cause such a huge impact on physicians, this is going to become a part of your training. You are dependent as physicians or as practice managers on clinical staff and your front desk teams to filter your patients. Here are the patients that I cannot see because of payer limitations and policy issues and documentation issues and other issues. And now all of those staff members are going to need to be retrained, and they're going to need to learn about those new policies. And of course, as a result of which, even the best trained practices will see that reduction initially, at least, in cash flow and in how efficiently they see patients. So is your billing department then, that crucial part of your practice, ready for this change? Are they up for the challenge? How well do you know your billing department? Do you know what kind of a job they're doing right now? And to know that, you need some kind of reporting. You need what we call key performance indicators from your teams. And one of those indicators is where your denials stand at right now. So ICD-10 is old school. We've been working with it for a long time. Payer policies are fairly standard and consistent. And at this point of time, if you're averaging more than 4% in denials, then your team is doing not so well. Your billing team is costing you $30 per denial in additional time, in additional effort, in the additional paperwork that's needed to get those claims processed. So imagine the time and effort it'll take to fix twice as many denials, and twice as many denials that are so much more complex than what you see right now. Right? So another important aspect of your billing team is, of course, have you started training them? Have they already been trained on ICD-10? AHIMA, American Health Information Management Association, is stating that for the clinical modulation of ICD-10, which professional billing uses, about 16 hours of training goes into that, 24 hours on the procedural coding system in ICD-10, and 10 hours in practice implementation. And this is just a training aspect. After you do this, of course, there's certifications and there's additional concerns that you need to go through. We're not even talking about workflow. Simply training your billers and training your coders will cause this kind of impact on time and effort. And where will you be training them? How much time will they spend? Will that be time that you will be taking out of their work hours right now? How much effort, and who's going to pay for those trainings? So all of those are questions that you need to be asking right now. What if you decided that you're going to hire a professional coder? That is going to cost you a significant amount of money annually. If you have a current billing team, then retraining them versus hiring a new resource, those are two large cost aspects of the ICD-10 change. And if you don't have enough billers or coders, and you need additional resources, or now you're budgeting for more staff. So another aspect of your billing that we need to work on, of course, or we need to look at, is accounts receivables management. So how much money is out there? How long does it take you to get paid? On average, getting paid from primary insurances should take you about 30 days. If you have claims that are related to worker compensation or no fault, maybe they're taking a little bit longer. Getting secondary, tertiary patient payments in maybe takes you 60 plus days to completely get paid on services that you've built out. So now, if your current team is exceeding 120 days in getting you paid, then they're not doing a great enough job. If you're not getting periodic reporting from your system or from your team, then there's an issue there. You don't know how well they're doing. And if your team isn't able to provide you with specialty level comparisons with other physicians, with other people in your geographic area, and give you an idea of what revenue streams other physicians are pursuing, or what concerns everybody's having, so that you know that this is something that everybody's facing, and maybe you could work together with other teams to resolve those issues. And of course, 2015, this year, is the year of penalties. So everybody has started facing penalties for not complying with Physician Quality Reporting System, PQRS, for Medicare, for Meaningful Use Stage 2. Is your team ready to get you through Meaningful Use and get you through Physician Quality Reporting System and get you through ICD-10 at the same time? Are you prepared to handle all three of those major ticket items for your practice this year? And of course, last but not least, in terms of timeline, how much time do you think you need to spend to prepare adequately for this change? So CMS, and way back, they issued a generic timeline, and they predicted that a practice would take anywhere up to 18 months to prepare for this change. That's a recommended timeline. That means that if you have that much time, then you'll be able to go through and in a very structured manner, train everybody, switch everybody, test everything, and be ready for that switch. And now, at this time, we're left with 31 weeks. Are you on track? Do you think you have sufficient time? Unless you've already thought about this, and unless you're already preparing and you've budgeted and you've gotten some kind of plan in place, you're at the very edge of how much time you need to get prepared for this change. So, is your practice prepared for ICD-10? Talk to your team, talk to your billers, and if that's not the case, then this is the time where you want to consider outsourcing, because it's going to take some time for you to implement a new system, maybe, for you to gel with a new billing team, maybe, and only after that will you be well aware of where you are as a practice. And we're not even talking about, of course, preparing the clinical aspect of your team to work with this change. So we're going to go ahead and then take a look at some of the pros and cons of an in-house billing team versus an outsourced billing team. So an in-house billing team, of course, you may have long-term employees. You have trust developed with your team. And, of course, you have hands-on control. So you can decide the direction the team will go in. You can make immediate changes, of course. You have close proximity with that team, so you can immediately go over and discuss issues. There's you've already spent a considerable amount of time training them, so they're already there, and they're, your team members that will be able to support you through this change. But negative aspects, of course, are the higher costs, number one. A billing team that you have, they'll have to be retrained, as we said. They have salaries, benefits, equipment needs to be assigned to each member. All of those things, of course, add to a cost aspect towards your billing team. And then liabilities. So we have noticed for practices that are not well organized, that are not run very well, that there is neglect, and there are billing items that are left on the table and that are never pursued because the billing team, it controls everything. As a third party, your outsourced billing team is probably going to be very actively going after anything left on the table because that impacts their bottom line directly. So those are the major aspects of a in-house billing team. But an outsourced billing team, of course, number one, probably less expensive. The training for those employees, the hiring, if an employee leaves and replacing that employee, that is all going to be the concern of your outsourced billing team. And of course, consistency. So that billing team is going to be contractually obligated to perform a certain set of tasks. They'll be responsible for staffing. They'll be responsible to ensure that sufficient people are on your team and they're sufficiently trained. Some negatives, of course, you have to relinquish control, so you can't be hands-on. You can't control every aspect of your billing. Of course, the cost factor, there's a variability. So as you see more and less patients, as your encounters go up and down, the cost is usually a percentage fee, so that increases and decreases. That's variable. And of course, with your billing team in-house, you had a fixed cost that you were aware of. In addition to those kinds of costs, there may be additional fees for cancellations or startup charges. So if there's any of those kinds of fees, you need to be looking at your contracts in a lot of detail to make sure how that's going to be set up. So a lot of practices, once they switch over to an outsourced billing team, report a 6% increase in revenue. That may not sound like much, but that's an immediate impact. And that means that that is revenue that you were losing out on. Just removing that neglect and removing those things that were taken for granted immediately result in that kind of improvement. 90% of small practices report that they want to switch over to an outsourced billing team. And this is based on a Black Book ranking survey from 2014. And again, this is because the cost and the time and effort that it's going to take to update the knowledge of your billing team and to make sure that everything is appropriately handled via HIPAA and via business associate agreements. All of that is in place, and that is good to go with that billing team that you're going to work with. So how do you want to choose, or how do you go about choosing the right billing vendor? And what kind of questions do you want to be able to ask? So one of the big ticket items in which everybody promotes and markets themselves on is low cost and low rates. So here's a billing team. They're great because they charge you the bare minimum, but there's a risk associated with it, right? A good quality team, of course, and a well-trained team and a team that is prepared for changes, of course, incurs additional costs. And a good billing company will ensure that they're giving you quality as opposed to, bare bones cost. Your billing team, you want to go ahead and talk to them about a HIPAA-compliant business associate agreement. So they're ensuring the privacy of data and the security of your data. You're assuming that your billing service employees are up to date on regulations and payer requirements, and this is something that you need to ask about. Not everybody trains their resources the same way. You need to make sure that you have a contract in place with your billing team, with your billing vendor, and that contract specifies, what tasks are going to be the responsibility of the billing vendor, what's going to be your responsibility, what pairs you're going to work with, whether there are any service level agreements, what the terms for termination are, just so that you're aware of what you're getting into. So talking about all of these things, we want to also ask you another question, and this is, what is your strategy for ICD-10 so far at this moment? Are you fairly sure that you want to go at it alone? Are you convinced that you want to offer it to a outsourced company, that you want to offer your billing to an outsourced company, or are you sure that you want to bring on a consultant to help you through this transition? So we're going to place that poll out there, and it's going to be available to you for about 30 seconds. And let's see what your thoughts are in that respect. Right, so we had a huge number of people initially saying they wanted to go it alone, but now that's sort of balanced between the other two items, bring somebody on board to help you within the practice, to train you within the practice, outsource to a billing company possibly. So a lot of people seem fairly confident that they know sufficiently about the changes that are coming up and the issues associated with that change. And great. So I think we're going to take about a couple of seconds more to finalize that poll. And yeah, so the largest percentage of our respondees said that they want to go at it alone. They're fairly confident that their system and their teams are trained and they're in place and they can help them get through this change. So let's talk a little bit, and we've talked and we've sort of discussed how you can gauge whether you are ready and your vendor is ready and you're able to go through those changes on your own. But we want to also talk about CureMD as a value proposition. What does CureMD have at this point in time that makes us a good proposition for this change? And the first item, of course, which many people said, is the least of their concerns, is of course a EHR PM system that is ICD-10 ready. And of course, not just ICD-10 ready, but being able to manage ICD-9 and ICD-10 in coordination at the same time through this year. So we've updated our cloud-based EHR last year, giving providers and our clients more than enough time to practice and to work through this change. And of course, we were working through that schedule, that timeline that CMS had predicted. Next up, of course, a consultation team. So a lot of you said that you want a consultation or a consultant coming to your office or maybe working with you day to day to help you through this process. And of course, we have an in-house consultation team that can assist you through the conversion process. They can make a plan and go through your workflows and decide what the best way of converting over to ICD-10 would be, set up deadlines and training and testing material and provide you with resources to get to that point. And of course, last but not least, we have a billing service in place that is trained on ICD-10. They have been trained, they have been prepped for this big change that's coming up. And this is a big area for us because CureMD in itself has a huge number of clients which are already utilizing not just the EMR and practice management system, but our in-house revenue cycle management services. So all of those clients are already dependent on us to be prepared for this big change. So we're going to sort of switch over to a Q&A session, and Mike will jump over and he'll give us some guidelines as to what we want to talk about.
Thank you so much, Ken, for that wonderful insight on ICD-10, and I'm pretty sure there are a lot of questions, as we can see, that are piling in at the moment. Over 500 questions are actually coming in right now. So, folks, we aren't going to waste much more time and start getting into those questions straight away. Unfortunately, we will not be able to answer all of them, but we will definitely get back to you with detailed replies. So let's go over and start seeing one of the questions that have come in. Okay, so Stacy has asked a question. Can I use a mapping system such as GEM for ICD-10?
Stacy, thank you for that question. General equivalence mapping systems were primarily created for large-scale conversions from ICD-9 to ICD-10. So most EHR, EMR vendors are including those kinds of mapping systems within their transition, within their upgrades. These tools are intended to convert existing information, so large-scale information that you had on your patient from before ICD-10 to ICD-10. So that conversion will take place. But they're not always specific enough to drill down to the 4th through 7th digits of the ICD-10 codes. So in other areas, of course, there's no one-to-one mapping between an ICD-9 and ICD-10 code, so these tools will be definitive in many situations. So for coding claims, it is more efficient and it's more accurate to work from the medical documentation, giving you the most specific ICD-10 code.
All right, thank you so much, Ken. So I'm just going to go ahead and pick out some of the questions which are in common and are coming in a lot. So one of these questions, Ken, that are posed is, how long will ICD-10 implementation take for a practice?
Right, so this will differ for each practice and the level of training and learning that you already have in place. But the general guidance is that it will take about 18 months for a orderly, well-planned implementation to take place. But since we're closer to that compliance date, you should be spending all the time that you have left available, especially if you haven't started planning yet. Make sure you're up and running, you have your plan in place, you have your training ceilings in place, and of course, then you're able to do testing prior to coming online or coming on board with that compliance date.
Okay, Ken, and in regards to that, a lot of the questions that I'm seeing is that people are generally asking that they have still not begun on the implementation process. So roughly you're saying about 18 months. So that means that people need to get to this now and start developing a plan, finding a vendor, and getting into the whole ICD-10 process?
Absolutely. There is no reason and there's no time for delay. You should begin right now.
All right, so moving on. Another question that's come in, what is the biggest change that ICD-10 will cause for providers?
So because ICD-10 codes are that much more specific than ICD-9 codes, and this relates to, of course, laterality, so the right side of the body versus the left side of the body, or what specific kind of scenario, symptoms, documentation will be the core issue. It will be the biggest change. And since this relates to physicians and MAs and their staff, many unspecified codes have been eliminated completely from ICD-10. So the documentation needs to be revised. Super bills need to be revised so that you're collecting the appropriate amount of information for ICD-10 coding.
Okay, and we have a question coming in here from Elizabeth. Will providers be able to use ICD-10 codes on claims prior to the October 1st implementation date?
No, the conversion is going to be based on date of service. So October 1st, 2015 as a date of service will be the first date that you can use an ICD-10 code on. Using an ICD-10 code prior to that will have your claim returned as unprocessable. So it is only usable for dates of service in the last quarter.
Okay. Now, one of the questions that a lot of people are asking are in regards to training, and how much extensive training will they and their staff actually need here?
Right, so every person in the staff at a practice will need some level of ICD-10 training. They will need some level of exposure, but it's best to begin and focus on the experts, the physicians and the coders. Once they're trained, they can teach the remaining team members. Clinical staff need intermediate training, so they need to be able to update documentation requirements, update templates, etc. But you need to select, of course, what methods you're going to use to train your staff. Are you going to send them to a third-party site, or are you going to have somebody come to your office, or are you going to get them trained online?
Okay, while you were actually going ahead and responding to this, a follow-up question to this just came in, that would it be sufficient if you only train your coder for the ICD-10s?
No, that will not be sufficient. The coder can only, code on the basis of documentation, and it is upon the physicians or upon the clinical team to justify medical necessity of any treatment. Since ICD-10 is more robust and requires significant amount of patient-specific information, if the documentation is not complete and does not provide that detail, then the coder cannot code to the appropriate level. So the physician will be required to help.
Okay. One of the questions coming in from Dr. Hillman. Why should I outsource my medical billing when I already have a certified EMR?
A certified EMR will have the ICD-10 codes in the EMR. It may even help you select a code for a given situation. It may even help you convert from ICD-9 to ICD-10 for existing or patient historical diagnoses, but it will not tell you what else you need to implement ICD-10 in your practice. It will not give you any guidelines regarding the codes. If a claim is denied, you're going to be left on your own to deal with that denial and to respond to that denial. And similar to what I said earlier, we anticipate some payers will not be able to switch to ICD-10 in time, and you may be working in a dual coding system environment. So your billing team, outsourcing to a billing team will relieve you of a lot of responsibilities, especially if you're not already prepared.
Okay, Ken. The next question actually coming in is a concern following up with a complaint as well. So this one says that I'm not actually happy with my current medical billing vendor. So a lot of people have actually stated that question. And one has also asked that how easy is it going to be shipped to a new one?
Right. Shifting your vendor is only easy if your practice is well organized. So your billing vendor depends on you for a lot of information. A good billing vendor can ensure that there's no cash flow disruption by agreeing to specific timelines, by making sure that preparing for that switch includes talking about how information is going to be exchanged within the practice and the billing team, enrolling for electronic claims and remittances and direct deposits to your bank prior to that cutoff date. Usually a big concern for practices when switching billing teams is what will happen to current AR, what will happen to the bills that are out there right now. So for a new vendor, an AR project is extremely worthwhile. I mean, it's going to build credibility with the practice. It's going to ensure an immediate improvement in revenue if you can, take that AR and convert that into revenue. That's going to be the biggest impact during that transition. But working on that AR successfully requires data for the vendor. So the vendor needs to know, did the claims get filed on time? Were the claims already processed, or are they awaiting payment, or are they denied and they require appeals? And is the practice going to be able to help in supplying this information, in supplying medical records, and answering concerns that will help get those claims paid? So working on AR is a big ticket item, and vendors would love to do that. But if your practice is well organized and willing to assist, then changing vendors is a simple, coordinated upgrade of your billing team. So it's just an upgrade. It shouldn't affect your practice.
Okay, keeping the time in mind, we're going to go ahead and get in the last question for the day, and one of the most obvious ones that are coming in. That firstly, if you guys do decide to go ahead and switch, how soon should practices do it, and how easy is it going to be to go ahead from the ICD 9 to the ICD 10 conversion? So Ken, if you could add both of those in your final. So let me just repeat that one more time. It's going to be, if practices do decide to outsource, how soon should we do it? And what is the major difference that they're going to see between the ICD 9 to 10 codes?
Right, so ICD 9 to ICD 10, we talked a lot about how there's such a huge number of additional codes. ICD 10 was intended to update the terminology and disease classification to current clinical levels. So ICD 9 is a much older system in place. So the new ICD 10 system will have space for new codes. It will have specific codes, including laterality. It will include sites, severity of diseases, and it will allow greater automation at payers, and because they'll be able to filter your information that much better. And of course, for clinicians and for researchers, it's going to allow better analysis of diseases. So that's the impact of it. What it looks like to you is a different view of the coding system, additional levels of coding. The code will look, ICD-10 codes will look completely different to ICD-9 codes, and we are going to have a webinar that will train everybody on those basic changes and maybe give you a basic understanding of how the coding system is set up, ICD-10 coding system. So that will be a follow-up session that we will have. Just to close up, changing your systems is something that you should be looking at right now. Implementing a plan of change from ICD-9 to ICD-10 is something that you should be doing right now. And for all the additional questions that we have, Mike is telling me that we're going to be answering them as soon as possible. We're going to be working through them today and tomorrow and getting back to you with appropriate responses. Thank you very much.
Yes, Ken, thank you so much for that. And as Ken mentioned, there are so many questions still coming in based on contractual issues and what other practices might be facing. And we, once again, have taken all of those into account, and we will be sending a response to your questions very soon. Now, thank you, everyone, for being a part of today's presentation, and most of all to Ken for shedding so much light on the whole ICD-10 saga. Now, we hope that we were able to help you with this presentation. And in case if you need any other assistance, there are multiple ways that you can do it. Please go ahead and request for a demo so that you can actually see CureMD and how we've addressed ICD-10. Then if you want, you can go ahead and reach out to our ICD-10 experts and call them at 212-852-0279 extension 384. Once again, our ICD-10 experts will be readily available to go ahead and answer your call. And in case if you want to send us an email, definitely go ahead and do so at healthit@curemd.com. Once again, folks, thank you so much, and please do keep in mind that a mini handbook for ICD-10 will be sent over to all of the people who have attended this webinar and anyone in the future who's trying to contact us. We thank you so much for attending the webinar today and look forward to seeing you